My name is Bex, and I am the Executive Director of United to End Homelessness with Orange County United Way. And I've been really excited for today's community chat. We have these conversations once a month in which I have the privilege of bringing on guests to join me for a dialogue about something connected to homelessness. And so every month we welcome either local experts, national experts, people with lived experience and expertise of homelessness to just spend 30 plus minutes having a dialogue and a conversation on a subject that is top of mind around homelessness. And this month's community chat is going to be about the new, just released Unsheltered Homelessness Survey in Orange County. This is something that I was personally really excited to see the results of, had the privilege of being involved a little bit on the back end. And so I know firsthand the thoughtfulness that went into the creation of this survey. And so really thrilled today to be joined by Doug Becht, the Director of the Office of Care Coordination over at the County of Orange. Doug works in the CEO's office, and he'll share a little bit more about what his role entails and how he's connected to the survey in a moment. And also today, thrilled to be joined by Matt Bates, the Executive Vice President with CityNet. And CityNet have been long involved in our community doing research and censuses and point-in-time counts and surveys. So it brings a tremendous expertise to the conversation. And so before we get started, and I ask you to introduce yourselves just for anybody that joined us, I'm going to apologize again for our tech challenge. Thank you for alerting us. Thank you for finding a new one in your email and for joining us today. We are going to dive in. And so, Doug, I'm going to come to you first. Would love for you to introduce yourself to our attendees and explain a little bit about the role of the Office of Care Coordination and how you're connected to other entities in the community. Oh, and we can't hear you.
That's 2 times in a row. Good afternoon, everyone. My name's Doug Becht. Thank you for giving me some time today. I am the Director of the Office of Care Coordination. As Bex mentioned, it's located in our County Executive Office. And for those of you that don't know, the Office of Care Coordination plays a couple of different roles, mostly related to addressing homelessness and being the county's office in charge of coordinating the county's approach to addressing homelessness. With that being said, our office is also the administrative entity of our continuum of care here in the county. So we staff that. That's a specific body that is responsible for helping prioritize and allocate funding from the federal government and the state, from the state as well. It's separate from the county, but our office is its legal entity and helps staff and do all of the administrative piece of that. So you'll often hear about the Office of Care Coordination and the COC being linked together. Why I'm here today is linked to the Commission to End Homelessness, which is an advisory body that's appointed by the Board of Supervisors that helps advocate and provide policy recommendations up to the Board of Supervisors around addressing homelessness here in the county. It's also a commission that has 20 commissioners, all of them executive leaders throughout the county doing really powerful and impactful work to address homelessness. Two of our commissioners are Board of Supervisors. Everyone else is not necessarily directly connected to the county. So although it's a county commission, it's made up of people both inside and out of the County of Orange structure.
Wonderful. Thank you, Doug. I know it's a complex role that you and your team hold, and you did a great job of explaining all of the different facets of your involvement in a very succinct way. So thank you for that. That's just really helpful framework as we move into today's dialogue and conversation. And so, Matt, I'll come over to you. Tell us more about CityNet's sort of role in addressing homelessness in Orange County.
Thank you. Thank you also for the invitation. It's great to see everybody and to be together. I'm excited about this conversation because I think this is a really important set of data that should be viewed in conjunction with other data that's been collected. And I think that it can really spur some interesting conversations about how to tailor the response to homelessness in Orange County. As an agency, CityNet, we're engaged currently in doing outreach and engagement with large projects in cities like Santa Ana and Anaheim. We also are providing bridge housing, transitional housing. In the past, we've operated shelters in Orange County. We currently operate shelters in other counties and are engaged in permanent supportive housing. So kind of all along the spectrum, but most relevant to our conversation today, starting in 2016 in Buena Park in Orange County, we did a citywide homeless census for the city of Buena Park. That was back in 2016. And since then, we've done 50 or more of these kinds of projects, whether that's for counties or cities where we do survey-based counts, trying to interview homeless neighbors to get their perspectives on homelessness and on the continuum of care that's designed to meet their needs and ideally to end their experience of homelessness. So we that work has included the point in time counts from 2019 and 2021, and we're also working hard, or actually 2022, excuse me, and then we're also working hard on the point in time count for 2024 coming up this next winter. So we've collected lots of data over the years, looking at the total number of surveys. It's over 13,000 at this point that we've conducted. So we've got a good sense of the realities of homelessness, but even still, we still find surprises. And so this project in particular was quite a bit different than others that we've done, and we'll talk more about that. But we're excited because I think it's yielded some things that are really interesting to look at together.
Absolutely. Thank you, Matt, for explaining the vast history and experience that CityNet brings to the table for this survey in particular. So you mentioned the point in time count, and for anybody who's joining us today who doesn't kind of know what the point in time count is, it's a HUD required count. They put a lot of kind of clear parameters on what you can and can't do during a point in time count. And as Matt mentioned, the last one was 2022. We're gearing up for the next one in 2024. But Doug, can you share from your vantage point, what was the motivation for this study? We know we have point in time counts, we know there's restrictions. So how does this study sort of build off what's happened? How did we arise at launching this study or survey to begin with?
Yeah, so the point in time count played a big role. As you and Matt mentioned, the point in time count is federally required, and it has a set of questions that are required with it. And every time that we report on our point in time count, often people will ask, well, did you ask this question or that question? And due to the federal requirements, and also due to trying to ensure that each point in time count is sort of an apples to apples comparison to the last one, so that we're able to compare, we really are mindful about ensuring that we're asking the same questions each year and make minimal changes. With that in mind, when we presented the 2022 point in time count results to the Commission to End Homelessness, they had asked if we were going to do a count, if the COC was going to do a count in 2023. And when we informed them that that wasn't the plan, they asked us to think about doing something different. And we used it as an opportunity to essentially survey unsheltered folks throughout Orange County. And in that survey, ask questions that we don't get to ask during the point in time count and that we're really interested in. And those questions that we asked with this point in time count were really related to why people are currently not accepting services, and and getting a greater understanding of the ties to the place where they're experiencing unsheltered homelessness. Unlike the point in time count, where it is a census and you get a sort of a census number at the end of it, the amount of estimated people that are experiencing homelessness, this was a survey. So as we go a little deeper into the results, there was no number coming out of this. The other thing that's important to distinguish between this and the point in time count is the point in time count is a census of both those that are experiencing sheltered homelessness and those experiencing unsheltered homelessness. With this survey, we decided to focus specifically on folks that are experiencing unsheltered homelessness. And our goal was to get a representative sample of roughly 20% of the population that's experiencing unsheltered homelessness during the 2022 point in time count. So essentially, we were looking to get a little over 600 surveys completed, which we did, which represents 20% of the unsheltered homeless population, according to the 2022 point in time count. And worth noting that I always want to make sure that we're really clear about is that CityNet, who conducted the survey, they surveyed 20% of each particular city's point in time count number from 2022. So it's important to note that what you'll be hearing in a few minutes is essentially results from hearing from over 600 people across Orange County in a very proportionate way that we feel does a good job representing the entire community's feedback.
Thank you, Doug. Matt, when it comes to how the survey was conducted and sort of the methodology and the approach to that, what is really important for people who are watching to know about that?
So it was a survey-based count, as Doug mentioned. We were attempting to get information, and as Doug mentioned, we went to all 34 cities plus the unincorporated areas. And just to kind of add some color to that, like if you think about if you're in a city that, let's say, has a homeless shelter, your experience of homelessness might be different than somebody in a city where there is no homeless shelter. And so we wanted to make sure that we got information from both. So we went to all 34 cities, all regions of the county, to gather that information. Just in terms of like, as Doug mentioned, like he mentioned, there were some additional categories in terms of like how that played out in the field. Just some like rough back of the envelope math for everyone. The survey was about 3 times as long as the point in time count. So if you've been a point in time count volunteer in the past, a surveyor, and you've gone out to the field, you probably were doing around 25 questions. And here it was, it depended on, because there were some conditional questions, but 50 to 60 questions. And many of those questions were more involved and more open-ended. So I think the thing that was interesting to us, one of the interesting things was that we were asking for feedback through this set of questions. Yes, we were capturing the demographic data and we were capturing a lot of the locations, as Doug mentioned, but we were also looking for input, and we were very pleased that even though the survey was long and it took more time, that the participants participated at a high rate, and they were willing to engage the complete survey, and they were really eager to offer their feedback and be partners in this work of providing care and designing a system of care that can be effective to end their experience of homelessness.
That was the part about this approach to this survey that I was really excited about and really appreciated the thoughtfulness of how it was put together to really get that feedback. It's not often that we are able to ask the people who are on the receiving end of services such clear questions and have this opportunity to kind of en masse throughout the county for feedback. And so it's something that I want to commend both of you for your leadership on moving that forward for our community. And so now we're just going to dive straight into some of the highlights of the report. And so, Doug, I know you sent us over some slides, so I will be your PowerPoint assistant, and would love for you to just kind of run through some of the key results from the report.
Yeah, absolutely. And I appreciate Bex. It can't be understated or overstated, I guess is the right term. This is essentially the voice of over 600 people that are experiencing homelessness, over 600 people that we're looking to serve each day. And I think, what we took away from it, especially when at least I got the first glimpse of the very raw data, was that um, it's really powerful information, and it's no longer someone like myself who sits in an administrative role that represents this population saying some of these things. It's straight from the people that we're trying to serve. So I'm really excited to go over a handful of the results. And I guess we'll start out, if you want to start out, Bex, and let me see. All right. So um, as we move forward, there was a handful of areas I'm going to touch on. I could spend all day on this, and I'd love to spend all day on this, but I won't. I'll hit the high levels. So I think the first area I wanted to highlight today was the outreach piece. We had asked all the respondents who were experiencing unsheltered homelessness if they had engaged with an outreach worker or a case manager in the last 3 months. And as you can see here, less than half of them said yes. I think this is an interesting stat. It's hard to really measure whether this is, I guess what I'll say is I've always reserved remarks or judgment on this particular stat as whether our system's doing a good job, a poor job, or an average job on engaging folks. But what is clear, excuse me, is that over half of the people report they haven't engaged with someone. So whether this is a reflection of our system really working more effectively than other systems because we just don't have data to compare this to, we still have over half the folks saying, hey, we haven't engaged with anyone for the last 3 months. And that means from an outreach perspective, we've really got to consider, our strategies. Are we going out at the right time? Are we going to the right places? Are we making ourselves, welcoming enough for people to feel comfortable approaching? So this was a major finding from ours. I know it's incredibly high level and basic, but it's powerful at very least. The additional piece that I want to talk about when it comes to some of our outreach data is that when we asked folks if they were engaged in the last 3 months, as you can see here on this slide, it's similar to the previous one where it highlights that a little over 47% said yes, they had been engaged, but only 20% of all respondents said I've been engaged and I've been linked to a service in the last 3 months. So 1 out of 5 people on the street in the last 3 months report that they've received some type of meaningful linkage to a service. So all things that I think with so much of this data, we need to reflect back as a system to say, hey, should we be doing a better job? How can we increase these numbers? I don't think it's fair for us to expect 100% on each metric, but obviously there's plenty of room for improvement. And where are those areas for improvement? I think one thing I'd like to note as we continue to go through this data is that this survey asked respondents about outreach and case management. That's the term we used. And then as we talk about shelters, we use just the term shelter. And the reason I'm pointing that out is because we didn't ask respondents to delineate between particular service providers. So it wasn't like we said, hey, have you engaged in with the county's outreach and engagement team in the last 3 months? Or if you engaged with the city of Anaheim's contracted CityNet provider team. This is really a reflection on the system as a whole. Bex, if you don't mind moving to the next slide. Then we asked folks about their shelter experience. As we sort of move from outreach and we go to shelter, we asked them about their shelter experience. And ironically enough, about the same percentage who said they'd been engaged in the last 3 months with an outreach team, we saw a similar percentage with people who said they had a history of being in shelter. So roughly a little under half the folks who are out on, who were surveyed that are experiencing unsheltered homelessness stated that they had been in a shelter previously. And that meant previously, whether it was a week ago, a month ago, a year ago, or 10 years ago. We didn't break down the length of time it had been since their last time experiencing shelter or going into shelter. When we moved further into it, and if you could advance the slides back, I'd appreciate it. We had asked folks, basically we asked them about one particular thing, one particular aspect in 3 different ways. We asked them essentially either why weren't they going into shelter, what do they consider when they are thinking about going to shelter, or why did they leave the shelter if they had a history of shelter. And what you can see on this slide is it's the result to all 3 of those questions. For the first box is asking those who said they were in shelter, why did they leave shelter? The second box asks is the response to the question we asked everyone, which was, what's the top reason you're not utilizing shelter? And then the third one is another question we asked everybody, which was, when thinking about going into shelter, what's the most important thing that you consider? And a lot of this, I think, to most of us, wasn't really surprising. But what we heard throughout all 3 questions, and they're highlighted here, is basically people, when they think about going to shelter, either going into it or leaving it, their top thoughts are around safety, privacy, respect from staff, and the rules. So really just basic things that we all think about whenever we enter a space. We want to feel respected. We want to feel that we have a little bit of privacy, that that the folks that it's a safe space. So we saw that through all 3 answers, which obviously is something that, as a shelter provider like the county is, we really want to continue to take a look back at our shelters and work with our shelter providers to say, okay, as we look at these, are we training our staff to ensure that they're welcoming and that they provide respect and dignity to folks? Are all of our rules necessary? Are there some rules either we could take away or we could modify? I think the one additional thing worth noting is in that middle box, you'll see that the top answer was a lack of available spots in the shelter. So about 1 in every 4 people said that the reason they're not utilizing shelter is because there isn't a space for them. So, I think another thing worth noting is that there are people out there that are still interested in coming in. We just, the demand is still higher than the supply, and that's worth noting. If you don't mind, moving on. Then we ask folks about disabling conditions. And disabling conditions, there's a couple of reasons why it's incredibly important. I asked this question. Obviously, we want to understand what people are, challenged with besides homelessness when they're out on the street, that are extra barriers or additional barriers to addressing their homelessness or addressing other problems in their life. But the other reason is sort of a very administrative reason is because, as most of you know, so much of the housing and many of the resources geared towards people experiencing unsheltered homelessness or homelessness in general is for individuals that fit the HUD chronic definition. Housing and Urban Development, U.S. Department of Housing and Urban Development's definition for chronic homelessness. And that definition is a combination of having a long length of homelessness and having a disabling condition. So what you're seeing here on the slide is we asked respondents about 7 different disabling conditions. We asked them essentially 7 different questions, asking if they were experiencing each one of those 7 disabling conditions. And what's really interesting here is that over 80% of the folks we surveyed stated that they had at least one disabling condition. And then almost 70% stated that they had at least 2. and as you can see here, almost half of the folks who were surveyed said they were dealing with at least 3 disabling conditions. So that's, for example, that's that might be substance use, mental illness, physical disability, a certain health condition. So really significant conditions. And when we saw this, we also looked at the data to see whether or not people who have reported experiencing homelessness longer had more disabling conditions. We didn't see that in the data, and we really looked close at it. But I think what's worth noting is that people who are out longer, often that means that you have to be managing that disabling condition longer. And the longer you're out there, as we know, the more difficult it is to potentially address mental illness, substance use, a physical condition, how difficult it is to go to appointments to address those issues, take medication, go to therapy, things to that nature. So something that a disabling condition they might have experienced when they were housed, might have been a lot more manageable and didn't have such a great impact on their life compared to when they're experiencing homelessness, especially homelessness for a long period of time. And each day, as you can imagine, someone's primary interest is, trying to find a place to sleep at night, how difficult it might be to manage these disabling conditions. As we transition and we looked at the data to look at how many of these, how many survey respondents fit in under HUD's chronic homeless definition. We didn't show the slide here, but roughly 80% of it was a little over 82% of the respondents to this survey stated that they have been experiencing homelessness for over 1 year, which was another remarkable statistic. So when you combined that data point, how long someone's been experiencing homelessness, with the disabling conditions criteria, what we saw was 69% of folks that we surveyed fit under HUD's chronic homeless definition. I mentioned how geographically we feel like this was an equitable survey. We obviously measured and collected a significant amount of information on demographic information on each particular person. And what we saw with our demographic data was that this group that we surveyed, this little over 600 people, in almost every way, whether it was gender, race, geography, they were representative of the larger community. So the reason I mention that is because when you compare the 69% to the 55% that fell into this bucket during the point in time count during 2022, you can see a significant increase there. And something that obviously tells us how we need to continue to shape our system. If you want to move one slide over. Now I want to transition into the community ties piece. As I mentioned at the top of my discussion, we really were looking to understand why people aren't engaging and how this in the system, and how we, in order to know how to better shape our system to get people to come on indoors and accept services. And then the second piece, which is what I'm about to talk about here, is to better understand people's ties to their community and to the location that they stay. So we asked 2 particular questions, as you can see here. First was, what is the main reason you stay in this location? And the top answer, and this is a question where people had to answer just one choice, where some of the others I went over, people were able to answer several choices. But here you were only allowed to answer one choice. And over 50% of the people said that they were most familiar with this location. That's why they stay here. Second answer, as you can see here, was that they have a friend or a family that lives nearby. And then third was that they feel safe in in this location. So I really combined all three of those answers because I think that one could argue it really says the same thing, which is that this is a location that they're comfortable with and they feel safe, and there's some type of familiarity to the location. And when you combine those numbers, that represents 85% of respondents said, hey, I'm here because I either know someone or I feel comfortable or I feel safe here. And I think this is one of those myths that this survey busts, which is that, at least I hear more often than I'd like to, this myth that people are coming to Orange County because of the great weather and they want to be by the beach and things to that nature. Many people have heard who work with me. My previous work is in New York, and when I worked in New York, everyone in New York thought people were coming from out of town because New York is New York and they have services. So what I've learned through my career is that every jurisdiction has a reason why their location is attractive to people experiencing homelessness and people commute in or travel to get there. And that's just false. And as one would, when you think about it objectively, when you're experiencing some type of crisis, the last thing you want to do is sort of leave a place of comfort and go into a place of unknown. So it's, whenever we're in crisis, often where we go is where we feel most comfortable, where we have, the most amount of history. So it just makes sense. And as a I appreciate this question because I think it definitely busts that particular myth. Then we asked folks about how they got to the location. That was another question that people wanted us to ask. And roughly 85% of the people said that they got to their location on their own. This isn't a group that, jurisdictions or communities are piling on buses or piling on trains and dropping them off into a different location. I think that's a myth we hear quite often. Lastly, we asked people a couple of questions, and we asked them 5 different questions about their community ties. And the reasons we asked them these 5 particular questions is because most jurisdictions ask one or a combination of these 5 questions to determine whether or not an individual is from their community or whether or not they should serve an individual that's experiencing homelessness in their community. As you can see here, the top line of the top row there of percentages represents the percentage of folks that stated yes to any of each of the 5 questions, that yes, the city they were surveyed in is the city that represents that particular answer. So as you can see here, 73% of people stated that the place they spent most of their time homeless was the city that we surveyed them in. And then when we looked at the data and extended that sort of circle to not only the city they were surveyed in, but a city that was physically neighboring the particular city they were surveyed in, that percentage rose to 90%. So it really backs the previous slide that talks about how people sort of like to be in one particular location and tend to be in one particular location. The other 4 questions, where's your last address? Do you have family ties in the county? Have you or are you going to school? And have you or are you employed here in the county, the city, or the spa? What we saw with the last address is what we see quite regularly with our point in time count and with other comparable studies. So basically 3 out of 4 people say that their last address was here in Orange County. As you go to the particular city, you see that percentage shrinks to under 40%. Family ties and schooling, I'd argue here show that that's not the best representation of whether or not someone's tied to a community. And then employment, those numbers are slightly higher. By and large, as you can see on this chart, the one thing that's clear is that people spend most of their time homeless in the location that they're currently in. They're not moving around a lot. And then lastly, the last slide I want to talk about, and I think the most important takeaway from this survey is that people are interested in engagement and assistance. One of the things going into this survey, and I think one of the myths, I'll say another myth that was busted is often people will say, oh, this is a group of people that are out on the street and they just don't want to be bothered and they never want any help or services. So we have 7 different data points that make it so incredibly crystal clear that that is not the case. So 77% of the people that were engaged to take this survey completed a survey. CityNet reports that their experience shows that usually the number's around 70%. So this is above average. And as Matt mentioned, this was quite a longer survey. This wasn't a quick engagement, and that's why we got high percentages. 78% of the people who completed the survey were willing to give their name and date of birth as part of the survey. So this is, yet again, a group that's comfortable giving their name and personal information when they feel like the information is going to go to good use and it's going to help them. 93% of people are either report that they either have an active benefit or actively enrolled in a social a support service. So almost every single person out on the street is engaged in the system somehow and is interested in improving their situation. 58% of people who are experiencing mental health condition reported that they are engaged in a mental health service or are interested, but were unable to access it. 49% of people who reported substance use disorder said that they were engaged in treatment or wanted treatment, but just couldn't access it. So almost one out of every 2 people said yes. And then at the bottom there, 64% of people stated that they were either receiving medical treatment or wanted to, but couldn't access it. So all of these statistics really hammer home, which I think if there's one takeaway from this survey, is that this is a group of folks that are interested in being engaged and interested in services. But it's important to note that it has to be the right service at the right time. And it's got to be provided in the right way. But if you're able to achieve those 3 things, people are willing to engage in the system. So with that, I'll hand it back over to you, Bex.
Wonderful. Thank you, Doug, for that quick but comprehensive overview of the survey. I know that there is a document with the full presentation that was given to the Commission to End Homelessness available, and I'm sure that Michael on our team will pop that link into the chat box for everybody. So anybody who wants to access the complete PowerPoint presentation to review all of the data can do so. So in our kind of remaining 10 minutes, I'd love to hear from each of you. And Matt, I'll come to you first to give Doug a little moment to catch his breath after that. Was there anything in the survey that surprised you? What are the takeaways from your vantage point?
So yes, is the answer. And I think I'd also say, the mark of good research isn't necessarily that it answers all the questions that you have, but that it actually spurs your thinking on to other additional important questions that need to be asked. It should answer some questions, but it should also, like if you think about academic research, typically academic research locates itself within research that's been done and how it builds on and advances that research, but also points to questions that can be asked in the future and the things that can be studied in the future. So for me, going over this material and being very involved with it, I still find myself, as Doug's talking, coming up with additional interesting questions that should be asked. So I think that, I think if you're as you're watching this, if questions are coming to mind, I think that's part of evidence that there's a strong data set that we're looking at. I think the surprise to me is the degree of chronicity. I think if I had to just distill it down to one thing, the amount of disability and the amount of chronic homelessness that was reported is shocking. To me, of all the things, I think that's what every time I think about this data set, that's what I come back to. And it's also when you overlay that with what Doug just most recently talked about, which is that there's a strong interest in help and engagement. That raises questions like, how can the continuum of care, how can the broader continuum of services, not just the county funded, but what the cities are doing, what private funders are funding, what nonprofits are engaged in, are they dealing with the level of chronicity that exists? So just like one interesting question, just as an example, in the data that Doug shared, there was over 100 people with 5 or more disabling conditions on that chart. And if you think about the existing shelters in the county, all the shelters, county funded, city funded, privately operated, are they equipped to handle a clientele with 5 or more disabling conditions? And if not, what would it look like for them to adjust services? And what would such a shelter look like? Because you've got an audience that is interested in receiving help and interested in ending their experience of homelessness, but they've got lots of disabilities. And so to me, that's where we can be reflective as a broader group and look inward and ask those questions of how can we adjust what we're doing to accommodate the realities of what we're seeing on the streets of Orange County. And I think there's probably dozens of questions like that could be asked. And I bring that one up just as an example of how this data set, when you analyze it, with the lens of system improvement and system performance, I think can be really important, not only in, as Doug mentions, kind of speaking to common perceptions or misperceptions about homelessness from the general public, but also those of us that are engaged in this work on a day-to-day basis, that we can use it to ask really important questions.
Absolutely. Yeah. I have lots of follow-up questions as well, as Doug knows. Doug, for you, what were kind of the surprises along the way?
Yeah, there was one data point that was interesting I didn't present on, but I thought was surprising, was we asked folks about their, like I mentioned, about their engagement with outreach and case management on the street. And one question we asked everybody was, what's the particular service that you're most interested in being provided while experiencing unsheltered homelessness by an outreach worker or case manager? And this was a question that people could answer multiple choices. The top answer was hygiene services, and hygiene services for this survey fit a large bucket. It could be hygiene products, it could be access to the bathroom, showers, things to that nature. And then the second answer was housing search assistance. And then the third was storage of personal belongings, and the fourth was financial assistance for rental deposit. And why I'm pointing that out is because what we see here is that people gave multiple answers, and they also stated services that they needed right away, but they were also able to think about services that would improve their situation long term. So I thought that was really interesting, that they were saying, hey, we've got needs now, and we also want you to help us with our long-term needs. It's not one or the other. And then the last piece that was interesting about that data point was we then asked the folks that had been engaged in the last 3 months, what has outreach talked to you about? And as I mentioned before, they want hygiene services. That was number one, but that was actually the much lower down on the list when it was what we actually talked to them about. It was the fifth most popular answer that was given in terms of what outreach actually talked to them about. Now, I don't think it needs to be an exact one-for-one, in those answers to each of those questions should be in the same order. But what it speaks to is are we doing a good enough job of hearing and listening to the people we're trying to serve? And are we providing them with the services that they are interested in? Or are we just going in too fast and too hard with our own agenda? And that's, a really, I think, classic example of so many of the data points here that should be used not only by the county, but all stakeholders here in Orange County to sort of reflect back on their own practices. Doesn't mean that if you're changing something, you're doing something wrong, but how can we do things better? And that should be what we're doing day in and day out in our homeless service system.
Thanks, Doug. As you were talking, I was being transported back to my career and before I joined United Way and the work that I did in the city of Costa Mesa, and we had done a survey of people experiencing homelessness in the city, smaller scale on this, but we still interviewed a significant amount of people to find out what the needs were. And at that time, the obvious one was housing, and then storage of belongings and hygiene were very high up on that list. And as a result from that, the work I was involved in then was rallying the faith community to address those needs. And that's how the check-in center that provides storage in the city of Costa Mesa came about as a direct response to that. And then also being able to provide through other people that I was connected with access to laundries and shower. And so we have some examples in the past of people responding to the voices of those experiencing homelessness. And I heard very clearly from both you and Matt that is the hope with this, is that people have spoken, they have shared with us what they need, and now it's sort of going to be over to decision makers, policy makers as to what they're going to do with that. And with 2 minutes left, anything that you want to add to that to help wrap up our conversation? Doug, I'll come to you first.
Yeah, I think, Bex, you provide a really good example there. You reference a survey that was done previously that said the same thing. And for those of us here in the work, I don't think any of us are surprised by these answers. But yet again, we hear it over and over and over for a reason, because that's what is needed. And I think that is, an important takeaway from this, from any survey that is done, that hears the voices of the people that you're wanting to serve. And when you hear repeated answers, you really have to pay attention and respond to those. And I'm excited, from the Office of Care Coordination and sort of the executive director of the Commission to End Homelessness. So many of the commissioners had committed to bringing this work and this survey back to the corner of the world that they oversee when it comes to homeless services, to reflect back on their system and the services they provide as well. And I hope, and I encourage anyone to reach out to me or my office that's interested in more information or a more robust dialogue about this work.
Matt.
Yeah, I think just quickly, I would suggest that, part of what the data shows is that we, as service providers, we need to think collectively as part of, we're part of a continuum of care. We're part of a system of care. And I think a lot of times the pressure, it's just natural. Like, we have our narrow focus, we have our marching orders, we have our contract, we have our deliverables, and we're going to do the work to do that. And it can be easy to just focus very narrowly. So when you get to something like, then homeless neighbors saying, well, we need hygiene services. It's like, oh, well, wait a second, like, that's not part of our scope of work. And maybe, when I hear that, as used as an example, like, I know that for street outreach prior to COVID, that there were more of those kinds of services being provided by churches and faith communities that were doing in-reaches. And I know that they got shut down during COVID. And so the question is, are they opened back up? Are they opened up to meet the need? Who's filling that gap? How can that gap be filled? Do we need to redefine the street outreach teams, that may be focused on housing to be more expansive or more broad? And also, do we have enough street outreach workers to meet the need? I think that's the other question that this raises is, when you get to things like showing gaps, part of the question needs to be like, well, do we have enough providers? Do we have enough individuals that are out there, given the needs of the population that exists, to go as wide as we would all like to go? And again, I think all of that, just fits to me under the headline of needing to see our work, even if it's in one particular area, as connected to a whole system of care. And the stronger that we can build the system of care, the better outcomes that we're going to have for the clients that we're tasked to help.
Thank you so much, Doug and Matt, for joining me today to have this conversation. I know that we could have kept going. I know there is so much more to unpack from this survey and the results of it. And as Matt said, it brings many questions to mind, and that is such a good place for us to be as a community. When we've heard this feedback and we have these questions for things that we need to think about more as a system, that's a good place to be. And so I would say if anybody watching has had questions that have come to mind, please feel free to reach out. We can gladly pass those on to Doug and to Matt. And we'd be really curious your thoughts on the survey and the findings that were presented today. This video will go up on YouTube. So it'll be available on the United to End Homelessness YouTube page or channel, whatever I'm supposed to call it. It'll be available there for you to share this out with people that could have made today's webinar session. We thank you and apologize again for our technical difficulties earlier. There's a quick little poll that's popped up here. If you could take a moment to fill that in for us, that would be incredibly helpful. And there will be some future opportunities. If you heard this and you are motivated to get involved and engaged, there's an opportunity coming up in January. I know it's October and January seems far away, but it'll be here before we know it. At the next point in time count. So keep an eye on the Everyone Counts OC website. That'll be going live over the next few days to sign up to volunteer to get involved in that. Thank you, Matt. Thank you, Doug. Thank you to everybody who joined us for today's community chat. I will see you next time.